Good evening, everyone, and thank you for joining us for the virtual town hall meeting. We are delighted that you took some time out to join us this evening. We've got lots of questions. We thank you for putting your questions in today, and we're going to get right to it. Our guest speakers today is, of course, the Premier, the Honorable David Burt, the Minister of Health, the Honorable Kim Wilson, and the Minister of Youth, Culture, and Sport, the Honorable Senator, the Honorable Dr. Ernest Peets. And we'll start with just brief remarks from from the Premier and the Ministers, and then we'll go right to questions, promise. Premier, you're up first.
Thank you very much. Good evening to you, Tina. Good evening, ministers, and certainly good evening, Bermuda. First, I would like to begin tonight by remembering those 119 persons in our community whom we have lost to the coronavirus, and ask that we also continue to pray for those currently battling the virus at home or in the hospital, and those who are also dealing with the long-term effects of this virus. I would also like to recognize all those who have worked tirelessly on the front lines of our pandemic response over these past 2 years. As a country, we should be immensely proud of the incredible work of our dedicated healthcare workers and all those involved in providing the essential services our country needs day in and day out. And I thank the people of Bermuda for their understanding and their cooperation. As a country, we've had to strike a difficult balance throughout the last 2 years, with the priority being to protect public health and our healthcare system, as well as ensuring that our economy can continue to function and that our students' education is disrupted as little as possible. I know that this has not been easy, and it has required sacrifice, patience, and hard work. And I commend each and every member of our community for the role that they have played in helping us to get to where we are today, where we can begin to plan for the end of the majority of public health restrictions and look forward to the future with hope and optimism. On Friday, the government announced a number of important changes to public health regulations and our border policy that supports our local businesses, encourage more economic activity, and will also encourage tourism as we head towards our traditional tourism season. However, I recognize that such significant changes means that members of the public will have questions about how these changes affect them personally, questions about how the government's plans for as we move beyond the pandemic, and will need clarity on certain points given the vast amount of details such announcements contain. That is why I felt it was critical that the Minister of Health, the Minister of Youth, Culture, and Sport, and myself take the time out tonight to further discuss the changes announced in the House of Assembly last week, Friday. And most importantly, hear feedback from the public and answer questions that you may have on how these changes affect you and provide clarity where clarity may be needed. I thank the Minister of Health, the Honorable Kim Wilson, and the Minister of Youth, Culture, and Sport, Dr. the Honorable Ernest Peets, for joining me this evening. And I look forward to an informative and constructive conversation with the people of Bermuda. Thank you very much. Minister of Health.
Thank you, and good evening, everyone. I am happy to be able to join with you this evening to further discuss the changes that were announced on Friday in the House of Assembly to the public health regulations, as well as to answer any questions from the community concerning these. As I said last week, the pandemic is not over for the world, but in Bermuda, it is in a position as a country to move out of the substantive public health emergency restrictions. We are now at the stage that we must learn to live with COVID-19. The government's shift to living with COVID requires all of us to take personal responsibility for our actions. We must look out for each other. We must act responsibly and adhere to the public health guidelines. Essentially, we must take responsibility for ourselves and others in our community. Currently, there are 311 active cases, of which 300 are under public health monitoring and 11 are in hospital with 1 in intensive care. And as of February the 5th, which was the end of Epi Week number 5, 71.9% of Bermuda's total population is fully immunized against COVID-19. And although the Omicron variant is still with us, compared with the Delta variant, we have seen so far experienced significantly fewer hospitalizations and deaths. Just to remind members of the public, the changes to the public health COVID-19 emergency powers phased reopening regulations 2021 are as follows. The size of large groups increased from 20 to 100, and this includes weddings and funerals as well as island boats. In restaurants, members clubs, bars, gyms, and island boats, SafeKey will no longer be mandatory, which means a student's 7-day pass is no longer required to attend these venues. Tables will continue to be limited to groups of 10 and must be spaced 6 feet apart. Within these dining establishments, bars, and clubs will still have restricted seating with respect to service only. The requirement to wear a mask while indoors in all venues will continue. The government anticipates this transition stage will continue until the end of March. From April onwards, the public health emergency will be in place to support only the continued requirement to wear masks indoors. Restaurants, bars, and clubs must still collect contact tracing information. Contact tracing is an essential part of controlling outbreaks and the main way to stop any further spread. To decrease the odds of getting COVID, increase fresh air into ventilation where possible. As well, do not go to work or to school if you are feeling ill. Avoid the 3 C's, closed spaces, crowded places, and close contact settings. Again, follow public health guidelines. Wear a mask, practice good hand hygiene, and maintain physical distancing. And I'd again like to take this opportunity to thank the Bermuda community for their adherence to the public health restrictions. While they were necessary, we know these measures have taken a great toll economically, socially, and in terms of our mental, if not our physical health. So again, Bermuda, thank you. You've helped us tremendously in getting to the position where we are today. Thank you. Minister Peets.
Thank you, Minister of Health. Thank you, Honorable Premier, and good evening to Bermuda. I hope you and your families are staying safe. Bermuda has come such a long way in these last 2 years. We're extremely grateful for all the public servants, essential workers, and healthcare teams who are working day in and day out to keep our country running. We're also very thankful to you, the public, for your cooperation as well as your understanding. As we announced on Friday, there have been changes to the rules governing sports and large group exemptions. Return to play guidance will no longer require SafeKey for sporting events within the permitted number of 100 attendees. The testing framework for athletes, coaches, and all those involved in the event operation will now require either twice weekly antigen testing or antigen testing on the day of training or competition. Large group exemptions for outdoor events, that's including sports, will not require SafeKey. However, indoor events with over 100 attendees will continue to require SafeKey. More specific guidelines for the current phase are as follows. Sport is currently at level 3B, that's indoor and outdoor sports. All activity is permitted within the sporting group. Spectators are permitted up to a maximum permitted by the public health regulations, 100 including sporting group and spectators. Also outdoor spectators, this includes those who are parents or guardians, no longer need antigen tests or SafeKey. Antigen testing is required for the sporting group. As the Minister of Youth, Culture, and Sport, I'm looking forward to the year ahead. We're in the process of reviewing our planning for the Bermuda Day and Heritage Month celebrations. We're looking at ways to see how we can safely host this signature cultural event for all of us to enjoy. And our ministry is excited to support the organizers of SailGP and the Bermuda Triangle Cup football competition as they prepare to host 2 major upcoming events in Bermuda this year. So we're very optimistic about the months ahead. For our ministry's part, we'll continue to do what we can to ensure that our youth, cultural, and sporting communities are celebrated, supported, and uplifted. Please continue to engage in the required health measures so that you and your family continue to stay safe. Thank you very much.
And thank you, Minister Peets, Premier, and Minister Wilson. We're delighted. We got several questions, many questions. So we want to get right into it. And we're going to start out with the announcement, as you said, Premier, the announcement on Friday, changes to the public health regulations. The big question, and I heard it over the weekend too, why is the Premier waiting till March 7th to make these changes? Why the wait? Why not just go ahead and institute it? Premier?
Thank you, Tina. The one thing about the government is that we do our best to make sure that we consult with our stakeholders. And with interviews that I given earlier, the view was that these were going to come into place at April 1st, towards at the same time as the ending of the substantive public health emergency. However, with our tourism partners, with our hotel partners and others, there was a request to see if that could be advanced. The Minister of Transport has a number of cruises that are anticipating trying to come during the month of March, and we wanted to go ahead and get that moved up. So we went ahead and we moved it and set the date and the target for March 7th. The reason these things can't be done immediately is because it does take time to change the processes in the back end and the systems to make sure it works. And one of the things which we're trying to do is we're trying to provide a completely seamless visitor experience. This is slimming down the TA fee to make it more simple, to make sure that, for instance, people who need testing on island will be able to do that testing remotely, not have to leave their place of residence and go somewhere to get a test. So we're trying to make sure that we structure all of these things well. So we set the date for March 7th. That is 3 weeks earlier than we intended on putting it into place. And there's certainly going to be a lot of work, but I have no doubt that the public health teams working together with the Bermuda Tourism Authority and the Ministry of Transport will be able to achieve that aim.
Okay. And wasn't there a April 1st deadline as well? More changes that are coming in April 1st? Did I get that correct?
Well, not for the border. When the Minister of Health had announced the changes, we were intending on making all of the changes at the same time. So the ending of the substantive public health emergency, which ends large group sizes and all of those various restrictions, and also the border change at the same time. But there were requests from tourism partners, as I said, to move that date up. We did consult amongst ourselves and we set the date for March 7th, which we hope will give us enough time to put those things into place. So that's why they're set for that time.
Minister of Health, I'm going to throw this question to you. What is government's current position on working from home?
Tina, given the position where we are with respect to the virus, as I indicated, we have just over 300 active cases. Bermuda is really in a very good position, which is why we were able to announce the border changes as well as the substantial ending to most of the public health measures. So we are encouraging employers to have welcome back their employees back into the offices. Obviously, that will assist with respect to providing the much needed impetus of persons having restaurant lunches and the like. As well, we are also still encouraging persons to recognize and to remember that there are still public health guidelines that we want them to adhere to whilst they're at work, insofar as hand hygiene, physical distancing, and the like. But certainly, we are encouraging persons to go back and return to work into their environments.
Okay, very good. And for you, Minister Pete, so I know this weekend was the opening of sports, football. Everyone was excited for that. But what kind of regulations will we be seeing in the coming days? Well, especially because I know you got the Bermuda Triangle, as you just said, the Bermuda Triangle Cup football tournament. And you might just want to talk about that a little bit. Sail GP, and of course, Cup March. So what kind of public health regulations will we be looking at and permissions needed with that?
Yeah, thank you so much. Of course, Sail GP gets started on my birthday on May 14th. So I'm really looking forward to that. The Bermuda Triangle Cup, of course, is going to take place later this year in August, right after Cup Match, August 3rd through the 8th. And as it relates to these two events, anyone traveling, of course, will have to abide by our COVID border policies and whatever current guidance that will be in place at the time. So we're really excited about the changes that have been announced. As I've talked to many of our stakeholders, particularly our sporting stakeholders, everyone is really excited about the opportunity to see sport return as it relates to the removal of safe key, for example, and other restrictions as it relates to people gathering outdoors. So I'm really excited about these two events. They're going to really showcase Bermuda's beauty as well as our traditions and our talent.
Good. Moving the dial just a bit and the conversation. Of course, this weekend we saw that the parents, I forget the parents' name of the parent group, came out about wearing the mask and leave your mask at the cabinet doors. I will tell you this, Premier, Minister of Health, most of the questions that we got centered around children and schools and mask wearing. I'm going to give you just a couple of comments here that people they're wondering, are children being discriminated? Another one is like, one parent said, what is the timeline of the metric for getting rid of masks for children in school? This needs to be transparent. Families are now making decisions on whether to stay in Bermuda or go somewhere else. We had one mother, she just put it very plainly. She was like, please, I need you to make a decision about schools and children because it is just a strain for our family. Go ahead. And that's where.
Okay. Thank you, Tina. I can certainly appreciate the concerns that are being raised, particularly by the parents as it relates to their children and the requirement to be masked. I think we need to understand a couple of things. Children are very social beings, probably have better social lives than most of us. So they are spreading all around. And the reality is that the measures that the government is putting in place are designed to protect the entire community, not just one segment of the community. And children form part of that community. We've noticed that the interventions that we have put in place, in the ministry, we refer to it as the Swiss cheese model. And if you can picture, Swiss cheese has different holes in it. And when you put another layer of Swiss cheese on top of it, you're trying to close one hole. Well, if you can appreciate that the holes that we're speaking about are the holes with respect to or putting the next piece of cheese on top of the hole is to try to prevent COVID. So for example, one of the holes may very well be the wearing of masks. Well, we want to, that's a gap in the system. So we want to put a piece of Swiss cheese on top of that, covers that hole, but it exposes another hole. That other hole can be covered, can be referred to as you must require physical distancing. Then we put another piece. So the Swiss cheese model is what we measure. So in essence, and I don't know why I'm talking about food, because it might be because I'm hungry, but the reality is that there are a number of measures that we put in place to protect the entire community, not just our children. So it's the mask wearing, it's the physical distancing, it's the hand hygiene. We appreciate the needs for our children to be in school, and we want to do what we can to keep them in school. And we've had quite a number of outbreaks. I have some statistics here with respect to Bermuda. We've had over 62 outbreaks in the schools last year. And of course, we've seen more children that have had Omicron in the last 2 months than 4 months of Delta. So children are being adversely impacted, unfortunately, by this particular variant. So in essence, and not to minimize the parents' concerns, because I understand and I get it, and we as a government appreciate it, but we also as a government are required to make sure that we look at addressing the needs of our whole community. And children are one facet of our community. Likewise, our elderly population. Regrettably, we have a lot of illness in our community, a lot of chronic diseases. Those individuals also require protection. So the measures that the government is putting in place are designed to protect the entire community.
And I guess that said, Minister, I guess the parents' real thing is, when can they expect? Is there some reasonable time frame that they can expect the restrictions to be removed?
One thing that you've noticed, this government has always been committed to reviewing our policies. And so for 2 years, I don't know how many press conferences we've done where there's been a review of a policy, and then we've delivered on that information. And then when circumstances change, more information, more evidence comes, then we review the policy and we make that announcement. So we are constantly reviewing our policies. One thing that we're really excited about is the fact that we now have the ability from the 19th of February to be able to immunize children between the ages of 5 and 11. Those are factors that will also feature into our policies as it relates to the amount of persons that are immunized. I've said before that we have over 70% of our population is immunized. That will increase because we'll now be able to immunize that particular group of children. It's interesting because we do receive quite a lot of correspondence from individuals that are saying, from parents saying, I don't want my children to be masked. Likewise, we receive quite a lot of correspondence from parents that are saying, I want masks to be in my classroom. I want my children protected. I want myself protected. I want the grandmother that my child is coming home to also protected. So as a government, we have to strike the right balance. And I believe that we have. However, to answer directly your question, Tina, we are constantly reviewing our policies based on the evidence, based on the science, and in particular, based on the data here in Bermuda.
That's fair enough. Premier, someone asked you directly, actually, and I think you're the one on this call that has on the Zoom in this meeting that has school-age children, and the person is asking, does Premier Burt, as a parent, appreciate that the restrictions in school are very difficult on children? If you want to answer that from a personal, go ahead, Premier.
Happy to answer from a personal circumstance, and absolutely. And remember, my children are in P1 and P3, they're 5 and 7. So, the emotional scarring, the challenges with, at-home testing, all of those things, I would love to see them end. I would love for me not to have to worry, about making sure that we wash the masks and make sure they have the fresh masks every day, or make sure all of these things are happening. But we're not there yet. And I think that's the key point. The one thing that I would sincerely hope is that in Bermuda, that this issue does not become a politicized issue as we've seen it in other places, and that we look at it based upon the science, the data. The government has shown that we can go ahead and make changes where necessary. But I think that we need to, I'm not going to say walk before we run, but I think that we need to recognize and understand. And I know that, certain people who are posting on Twitter about, our children, adults can go into bars, but, children and without a mask on, but why not children? The fact is children don't have a choice and option to go to school. They're in that space and they're there for a significant amount of time, whereas adults have the choice of what they expose themselves to. So it is a delicate balance. I accept, recognize, and understand what people have stated. And I think the Minister of Health has been very clear that we are making changes that are appropriate. There are some changes which have been discussed, which the Minister of Education will be announcing in the House of Assembly next week, Friday, and we'll certainly make him available for a similar town hall speaking about education and the various restrictions in schools. But there's persons who talk about, quarantine exposure, sending whole class at home. All of those matters are being reviewed and announcements will shortly be made. We just want to make sure that we are taking it carefully to ensure that we provide the safest environment for our children in school. So I hear what's happening. I know the Minister of Health is meeting with the group that has written to her in regards to masking in schools. And I know that she's meeting with that group tomorrow. So we will listen, and when the time is appropriate, certainly we can make adjustments if the data indicates that it's safe to do so.
Okay. I do want to go to, let's go to switch gears from the children now and go to the travel forms, the good old travel authorization. Will government consider exempting travel authorization fees for university students? Parents have been talking about that since back in the Christmas area. Go ahead, Todd.
I'll just answer it this way. I know that there's been lots of requests for either senior citizens or requests for other persons, young children, et cetera, and different things like that. The government has reacted, and we've listened, and we've reduced the travel authorization fee from $75 from all persons down to $40 for all persons. And I think those are the accommodations of which we're prepared to make at this time. From a broader level, I know that I've spoken about the fact that travel authorization is going to be in place until at least the end of the next fiscal year, which is March 2023. And I think it's important that people recognize and understand that the travel authorization is an important source of revenue for the government of Bermuda in a point in time where we have a very expensive coronavirus response that is taking place. We have to remember, we know the healthcare increase that was put in place. Part of that was not as high due to we were able to take money from the travel authorization to give towards the hospital, which needs to be funded in these very difficult times. In addition, whether it's the testing that we offer free of charge to individuals that are in the country, residents, the contact tracing, all of those things need to be paid for. And the government had the option of raising taxes on everyone, cutting services from the vulnerable in order to pay for that, or figuring out what is the best way to pay for the coronavirus response. And the view to pay for the coronavirus response was to do it from travelers, people who would be most using that particular service. So that's the approach of which we've taken. I recognize that certainly TA fees are not something that is light. I get it. They are, and that's why we're trying to make them simpler. But for the foreseeable future, they will be in place, as the truth is that the government has a very difficult job to balance to make sure we pay for and provide the services and to make sure that we support the hospital while paying for the need for I would say, the continued coronavirus response. So I understand that it is not light. That is the reason why we've certainly done a reduction of the cost, but it is important that people recognize the significant amount of revenue which provides services and also to support the hospital and to reduce the upward pressure on healthcare premiums.
Okay. Now, it was announced on Friday that the fees would be going down. Is that correct? Can you speak to that real quick?
Yes, the fees will go down from $75 to $40, and that will come into place on March 7th.
Okay. And the pretest, someone has said, well, if you're going to still charge me all this money, why am I paying out of my pocket for a pretest? Will there be an outage? But go ahead.
I mean, if you're a resident, you are not required to take a pretest. We can't tell someone that they can't come to return back to their place of birth, Bermudians. We can't tell them that they can't come back to Bermuda without taking a test. So you have an option of taking a pretest, or you have an option of taking a test on arrival. For visitors, they do not have the option of not taking a pretest, but they will have to take a pretest, and there is no test on arrival. But you have to remember, of course, that visitors, many will still require exit testing, and those exit tests will be paid for as part of the travel authorization fee. Also, there's the continuous monitoring that has to take place. There's someone who has to approve those travel authorizations to make sure that they're correct. So there is a significant amount, the helpline, all those things which we have in place have to make sure that they're continuously funded. So we are going to make the process more efficient. We are going to make it simple. But for at least the next fiscal year, the government has certainly budgeted for the travel authorization fee to be in place. And then at the next year, we can look at the removal of that TA fee and the travel authorization. It depends on what our coronavirus status may be at that time. But as the Minister of Health said, we are still in a pandemic. And though Bermuda is in a far more fortunate position than a lot of other countries, we have to remain vigilant. And the travel authorization that protects our borders is one of those key points of vigilance.
And in regards to, you were talking about travelers on the TA form, in regards to unvaccinated travelers, this person wrote in and said, to my knowledge, it has not been proven that vaccinated persons cannot pass on the virus. So how does this differ to non-vaccinated travelers? And they're saying the reality is unvaccinated people are usually more careful. They all have to pretest anyway, have restrictions on arrival. It makes no sense that they are not allowed to travel here. Unvaccinated travelers, non-vaccinated travelers.
I'll put it this way, and I'll let the Minister of Health certainly elaborate. As the Minister responsible for tourism, I would love as many people to come into the country as possible. And soon there may be the case for that. But I think it's important that we remember the purpose of our public health restrictions. And the purpose of our public health restrictions is to protect our healthcare system and pressure on the hospital. And it's a very key point in all of this matrix. So I know that people would want to focus on infection, and I know that people would want to focus on transmission. The truth is that if someone who has been vaccinated does get a coronavirus infection, the statistics show that they are much less likely to be hospitalized significantly. And whether or not you are someone who supports vaccination or someone who does not support vaccination, there is one place that cannot be argued, that persons who have been vaccinated or persons who may have protection due to a prior infection are far less likely to be hospitalized. And that's what our restrictions are about. It's about protecting the hospital and protecting our healthcare system. So yes, persons may be able to become infected, and yes, persons may be able to be transmission. But when we're talking about where we are in the I would say the coronavirus right now, what we're really focused on are severe cases, hospitalizations, and that's what we're protecting against. So in that case, when the country is open, there will be virus transmission that is going to happen in the country. And if we have someone from overseas, vaccinated, at the hospital, those are things that we're just not trying to, that's not where we are right now. 2023, that might be a different story, but that's not where we are right now. So we're taking a step at a time. I understand that it's inconvenient. I get it. I recognize that. But the truth is, the purpose of our restrictions are to protect the hospital. And that is the reason why The cabinet has made that decision, and that we will go ahead and review it at some point down in the future. But right now, this is what we've laid out, and that is very similar to many other jurisdictions that are competing against Bermuda.
And if I can just
Minister?
add,
Yeah, go ahead.
thank you. Yeah, just to add to what the Premier said, the government has made a decision, a deliberate decision to on twofold, and that our policies should address these two particular issues. One is to protect our borders, and two is to protect our healthcare system. We would have seen recently our healthcare system was overridden, and what we don't want to do is to try to avoid. What we want to do, excuse me, is to try to avoid both of those particular instances. We don't. When we talk about protecting our borders, we do recognize, as the Premier indicated, the level of transmissibility, et cetera, as it relates to persons that are unvaccinated. And our border is how the COVID is getting in, is at our border. So what we have to do is try as best to mitigate against those circumstances. We've changed our border controls, as the Premier indicated on Friday, and allowing for more flexibility for our travelers, particularly from other jurisdictions, to help to augment our tourism product. However, we still need to take steps to protect our border, as well as to not have a situation where our healthcare system is overrun.
And we'll speak to that border. We had someone that wrote in, and they're getting married this summer, and they're hoping to have unvaccinated family members from the overseas to be able to attend. And I mean, Premier, you as the Minister responsible for tourism and Minister of Health, you understand now people are starting to travel and getting their wedding plans and so forth, and vacation plans. How will we deal, and what will it look like in the summer for unvaccinated travelers coming to Bermuda, the potential?
If they're visitors, the rules are that they will not be able to get a travel authorization, just as it is right now.
And that's for the foreseeable future?
For the foreseeable future, yes.
Okay. All righty. We will move. I just want to switch over a little bit as well. We did talk about the Minister of Youth and Youth, Sport and Culture. We talked a little bit about the SAIL GP and so forth. For teams traveling, groups traveling overseas, sporting groups, and then coming back. I remember early on in the pandemic, we had that issue of people not being able to come back to the island and so forth. How is your ministry supporting sporting groups and kids wanting to travel abroad and coming back to Bermuda and so forth?
First of all, two things. We're certainly working with our partners at Bermuda Tourism Authority to actually bring more events here. It's certainly a lot easier to have our athletes enjoy competition by bringing the competition to our shores. I think Bermuda has a great product. And we're certainly looking forward to a lot of events coming to our shores this year, so that our athletes can actually compete against international competition. The other, of course, is education. So we certainly want our traveling teams, which are Bermudian teams leaving the country, to be aware of the COVID restrictions of where they're traveling, as well as be aware of our travel restrictions and guidance on return. So that's pretty much how we support them. And usually when there's an issue or question, they will either contact YSR directly, or sometimes they're able to reach me directly, and we're able to support them to handle any particular question or issue that they might be having as relates to getting back on the island.
Thank you, Minister, for that. We've got a couple of questions that are coming in right now. This question comes up too. And I think this is a good one, Minister, if you can, Minister of Health. Can you confirm what is fully immunized? What does that mean? We see the terminology. Is that 2 doses vaccine and the booster? Is that what fully immunized is?
It depends on the vaccination, and it is somewhat of a technical question, so I am going to repeat what the CMO said when that question's come up. But as I understand it, it depends on the nature of the vaccine. So, for example, if it's a vaccine that requires 2 doses, then it's the 2 doses 2 weeks after the second dose. However, I do know that one vaccine obviously has just the one dose, and I don't believe, and again, that is a question that I would invite the CMO to assist when we have our next technical briefing, because I don't believe that there's a uniform position as to where the booster falls insofar as if it's part of that classification of immunization yet. That information, that data is still being collected. But we will be, unfortunately, having more technical briefings. Hopefully that'll come in sooner rather than later. And the CMO will be able to address that question directly.
Okay. Yeah, we've got all the COVID questions and pandemic questions being asked right now, and travel authorization, which is someone else has come through on Facebook with required travel authorization. And what does the $300 fee for arriving with a pre-test, without a pre-test, still apply?
No.
No. It's going away. Yep. Okay. Alrighty. Okay. I'm going to switch gears. Let's switch gears for a minute. Let's switch gears and go to transport. And of course, I know people are asking this question. Premier, you got to field the transport questions today. When are the number of passengers on the bus going to increase?
Great question. Certainly, it would be no later than March 31st, because when we talk about the ending of public health restrictions, it is the ending of all public health restrictions, save and except as the minister has stated, mask indoors in certain circumstances. And so that means social distancing restrictions fall away, physical distancing restrictions fall away, which is what it has the restrictions on the number of people on buses. Large group exemptions fall away. There's no longer permission for any of those particular matters. So the answer to that question would be no later than March 31st. But the Cabinet COVID Committee does meet on a weekly basis. And so those policies are constantly under review. And I'm sure the Minister of Transport, who is on that, may bring that up for a further revision. But that certainly requires conversation, discussion with our union partners. But it will be no later than March 31st.
Yeah, and I know you can appreciate the concern, and I'm
Absolutely.
sure you've had questions as well as the
And I
health
promise
minister.
you, would love to increase that figure sooner rather than later. So that might be something that may increase sooner. So those are things that are under review. But the full answer that I can give with definitively is no later than March 31st.
Okay. This one, actually, this is from the RG, because the RG did put this through, and I did actually see it on social media. When the transport minister, in his statement on Friday in the House of Assembly, he talked about having between 500,000 and 650,000 tourists in the 2022-2023 season. And the question was, how is this achievable, especially with Southampton, Fairmont Southampton closed? Are you able to speak to that?
I absolutely can, and I'll do my best to be polite, because the Royal Gazette would have been able to listen to the statement, I assume. What he spoke to was travelers through the airport, and those figures come from Skyport. They contain arrivals and departures. And so the projections of which we have from Skyport at the low level is 250,000 arriving passengers. At the high level is 324,000 arriving passengers. That's a combination of locals and visitors. So those are the projections which we have from Skyport of where we are modeling our numbers. That was not a projection of visitor arrivals through the airport. And I just want to make that clear. I know that a question did come in from the media on that, and I do believe that was clarified, but if it's not, we certainly clarified that now. That was speaking about passengers that were going in and out of the airport, not necessarily visitor arrivals. So I hope that that is clear now.
Okay, there we go. All right, and here's another one. This is under another ministry, and the minister's not here, but Minister Premier, hopefully you'll speak to this one. The person says, I'm a digital nomad. I love living in Bermuda and contributing to society. We don't know about the future here, though, which is a little daunting. Do you know how long digital nomads will be able to stay in Bermuda? And we're glad to hear that you love living in Bermuda. and contributing to our
Thank
society.
you. Real simple question. One of the things that was in the economic recovery plan, and which was one of the suggestions which came out of the first committee that was set up during the pandemic, was the renewal of the digital Nomad program. And I do believe it is the intention of the Minister of Labor to renew that program indefinitely. So that person does not have to fear. I mean, people who are digital nomads are basically long-term visitors here in the island, and there is certainly a change and shift in the way in which we do things with remote work. And from the perspective of the government, it's certainly something we want to promote and to continue to promote. So I'm happy that they love being here, and they will continue to be able to renew their annual permission to reside, and they can just go ahead to the Ministry of Labor and do that right now if they wish.
Excellent. Thank you. And you spoke about the economic recovery plan. I know you gave an update in November. Will we be hearing more about the economic recovery plan before the budget, or?
Not likely. I may be giving a statement on the economic recovery plan on February 18th in the House, but we will be making sure that the website is updated and all the work continues on all the various matters. There's something that's coming to the cabinet next week on that specifically, and so the work continues. It is the focus of the work of the government. That's why we are so anxious to move beyond the pandemic and return ourselves to normalcy. So the Minister of Health was implementing one of the most important economic recovery plan initiatives, universal health care, which is vital and important. So the attention of the Ministry of Health can turn to that, and the attention on the other ministries that are doing things that are outside the pandemic, so they can focus on those matters. So absolutely, there'll be updates, and that's why it's vital so the government can get back to governing and not be solely restricted to governing pandemic.
Yeah, and when we talk about moving beyond the pandemic and returning to normal, that's interesting. We'll talk about that in a minute, but moving beyond the pandemic and the exciting news that restrictions will be relieved, and we will be relieved of some of the restrictions and the regulations by the 31st. Bermuda Day, Minister Peets. Tell us more. I think you made some mention about it. When do you think we'll actually have a parade this year?
The short answer is yes. The long answer is also yes. These last 2 years, of course, COVID has really changed how we express ourselves as well as enjoy ourselves, particularly as it relates to Bermuda Day. It's either curbed it or eliminated. So we're certainly excited about this year. I know the team at the Department of Culture has already begun their dialogue and internal conversations about Bermuda Day. Of course, we've already heard that as of March 31st, the large portions of our exemptions and restrictions fall away, which really opened up the door for us to really take what we've learned over the last 2 years and all the hard work that we've done to get us to this point, to allow the country to really open up and have some of our cultural things like Bermuda Day return in full. So I'm looking forward to Bermuda Day, to have a full parade with all of its pageantry and all of its spectacular things that we previously enjoyed. So I'm really excited about Bermuda Day this year, and as well as the other events that are being scheduled for the summer.
That's right, and Heritage Month will be the whole month long of events as well. And that takes us still moving beyond the pandemic. I know the next things parents will be looking at is summer. What am I going to do with my youth in the summer? Will we see the summer camps coming back? The government run summer camps. Any other programs that will likely happen for youth?
Yeah, absolutely. You know, our summer program and camps are extremely popular. They're fully subscribed every year, sometimes even with a waiting list. So I know parents are looking forward to registering their children for summer programs this year. So the team at YSR, they're well experienced. They've been doing this year in and year out for as long as I can remember. So they're well prepared for this summer. We're looking forward to doing some of the same exciting things that we would have done in years past. But of course, this summer with our progress with the pandemic and moving beyond the pandemic this summer, things are looking really, really good as relates to what our kids can expect regarding their experience this summer in our summer program.
Yeah, you had people lining up last year. Get my child in. Who can get in first? As Premier, I'm going to switch back to you for a minute on tourism. And this has just come in from Facebook. Can you speak to what is being done to revive tourism in Bermuda following the relaxation of restrictions? And what about those projections for the 2021, the 2022 year?
Certainly. And the projections which we're working from is that we want to return ourselves to 50% of where we were in 2019. That will certainly be a challenge on the air side without an operating Fairmont Southampton. But the Bermuda Tourism Authority is well underway in doing its digital marketing, in refreshing the brand of that we're going to be marketing to tourists to make sure we reposition ourselves and work on developing and rebuilding our on-island events, which I think is an important part of the experience nature of what we have with Bermuda. But with the relaxation of travel restrictions at the border and with the still relatively pent-up travel demand in the United States, we're expecting a strong season. And we're going to be working hand in hand with our hotel and tourism partners to make sure that we deliver. On the cruise side, however, we are expecting and have confirmed already 177 cruise calls, which is close to the record amounts of which we've had, which I think was 190 or so cruise calls. And these cruise ships, I don't think will be sailing completely full, but they'll be sailing largely with a significant number of persons. So we do believe that we'll be able to hit the 50% threshold there, but it's certainly going to take work on the air side without Fairmont Southampton being available this year.
Yeah. And I know you spoke about the development over at Bermudiana Beach that will probably come online next year. Is that correct?
Correct.
Yep. Right. Okay. You say on island experiences, and sometimes people don't know what that means. What do you mean by, because you put a lot of emphasis on island experience. What does that mean?
In my ministerial statement last week in the House, I says that Bermuda needs to be clear what it wants to be. We had a marketing presentation from the group Proverb, which is led by a Bermudian, Darren Bascom, out of Boston. Mm-hmm. And it speaks very specifically to the fact that Bermuda has to refresh its staid reputation. And that's part of, some of the pushback when we're seeing in some quarters where people are talking about, America's Cup and certain things and all the rest. This is not the future of where we want to be, and we have to make sure that we position ourselves in a different space to attract a different level of different type of clientele. But what's more important than that is that we have to actually deliver that experience when people come. And those were the questions which I asked as Minister responsible for tourism during these presentations. Are we able to deliver? So that means the experiences from the east end of the island to the west end of the island. That means our natural experience. That means our cultural experiences. That means our restaurant experience. That means our visitor experiences, wherever they are. What our visitors do when they come here. That's about product development, and that's about experience. And that's why we're going to make sure that we support product development this year so that our visitors have an excellent experience when they come on island. And that's what we're trying to make sure we do it. And we're going to do that right from the border to make it as seamless as possible, to make sure that you forget about whatever there is when it comes to pandemic and testing, et cetera. So you don't even have to leave your room and go somewhere for your exit testing. These are all the things which we're trying to do to make it a seamless visitor experience and enhance the experience of visiting Bermuda.
Yeah, that's cool. That's good. That's good. I'm listening to you and getting caught up in it, and I almost forgot some of the other questions as well. I know we've talked about this, and I know and I want to switch gears just a bit off of the tourism. The Minister of National Security addressed it, of course, gang violence and so forth, in her ministerial statement on Friday. I want to ask you, Minister Peets, because you also, work with young men and women as well as being the minister, but in your secular role as well. What do you say to Bermuda? It's so concerning to see the antisocial behavior. And it seems like it's trending forward and not moving backward, especially amongst our younger ones. I think all of us couldn't believe it when the minister said 8-year-olds in gangs or being, go ahead, speak to that.
Yeah, sure. Certainly, we're all humans and neighbors and family members. on this call tonight. So we certainly want to send our thoughts and prayers out to those families who have been negatively impacted by antisocial behavior and violence, particularly recently. We've certainly been concerned about that. And, I've had my conversations with my cabinet ministers, particularly Minister of National Security, and these issues are very, very sensitive and very, very important to us because, we live in this community and what happens in this community affects us all. As it relates to, my small little corner here in cabinet, of course, our ministry put out the youth policy, of which we're extremely proud of. This particular government needs to be applauded for the work that is put into this youth policy. So we're really excited about that. And there are 8 policy goals in that policy that we've pushed forward. And one of those policy goals is to address the issues around antisocial behavior. So later this month, in February, our working group will be finally constituted, and they'll begin the hard work of working with each other and working with the stakeholders to really help the government as well as the third sector and the private sector to really grapple with some of these issues that are affecting our youth. And one of those, of course, is antisocial behavior. So my encouragement to everyone who's listening to this call is to support the youth policy. As if one of the individuals from the working group reach out to you as an individual or as an organization, please lend your enthusiasm and your support. This is a multifaceted issue with its roots, and it's entangled in a lot of different issues. So one ministry and one department or one organization is not equipped to grapple with this particular phenomenon, but together we can certainly make some inroads. So I'm really excited about the opportunity to work with my colleagues on this.
Premier, did you want to touch on that at all? Or?
I think that the work that the Ministry of National Security is doing and the gang violence reduction team certainly must continue. The minister spoke about this in the House. I've certainly encouraged her to speak in the public domain. So she's doing a number of media appearances, speaking about this particular issue and speaking about the challenges of which we're facing. And though enforcement and the police action is not a matter for the government, that is a matter for Government House under the governor, we will continue to apply pressure. But this is not just a policing issue. This is certainly a community issue. And so the aspects and avenues and investments of which we're making to ensure that we can provide an avenue for young persons to have different and better options, I think is something that we have to continue. And so when we talk about the relaxation of public health restrictions to make sure that we can stimulate further economic activity, that is that is certainly an impact, because we have to recognize that the root causes of some of these matters are due to multi-generational factors and also to deal with economic opportunity. And so we're going to continue to press forward on that avenue. But it is certainly sad to see some of the actions of which we've seen that have taken place with the murders and the violence. But I know the Minister of National Security, along with the gang violence reduction team, will continue to speak to those matters and make sure that they address those matters and forcibly arrest those matters.
And Minister Peets, a question did come back in. Just to clarify, the large group exemptions, when will they be removed?
As we've indicated on this particular call, the restrictions will end on the 31st of March, saving, of course, the wearing of masks in certain conditions, particularly indoors. What that means for us, of course, is we no longer will require individuals to apply for large group exemptions. Okay. As it relates to that, there is no restrictions in gathering both indoors or outdoors, irregardless of space or venue. So March 31st.
Okay, very good. Moving beyond the pandemic, getting back to a new normal, what will that look like for so many of us? What that new normal will look like, but it certainly will be good to be able to go back to gathering and being together. I want to talk to you a question, and we're getting ready to wind down. One of the things during this challenging, Premier, you said it's been a challenging time. It's taken sacrifice and patience and hard work on all our behalves. Every single Bermudian resident has had to live with it. But one of the things during the pandemic that just came forward in a real way, and each of you, I'd like to ask you, um, the power, presence, and pressure that comes from the influence of social media. We saw it over and over again. I think when regulations came out, when vaccines came out, the misinformation, the disinformation, that information. How have you all in your ministries had to deal with that? And what have you learned from that in terms of that presence of social media?
I look at it, Tina, as just a part of a new normal. And so I think that from the perspective is that whether it's social media, whether it's the volume of emails of which we receive and people who communicate with us, whether or not we're in the community, it's just a factor of how you must govern. But when you start asking the question, I thought you were talking about, the immense pressure and sacrifice and things of which we've been under. And I just wanted almost to hand over to the Minister of Health because I just want to pay tribute to her in front of, the country. Because though a lot of stress and pressure falls upon me as leader of the country, I have never seen a public officer work as hard or a minister work as hard as the Minister of Health has done and lead her team through incredible challenges, whether it be travel authorizations, whether it be issues with testing, whether it be issues with, the hospital and the challenges there, standing up everything. And so from this experience, it has shown me the true value of not only the Minister of Health, but her leadership and her team, and certainly a debt of gratitude of an army of dedicated public officers who have done so much and have gone beyond over the last 2 years. So when it comes to sacrifice, there's always going to be people who make noise on social media. There's always going to be people who have thoughts and opinions. That's just the nature. Before that, it was talk shows or letters to the editor. That's the world has evolved. But we would have to remain focused on the work. And I just wanted to, take the time to give hats off, certainly to the Minister of Health, who's been here from the very beginning, doing this over 2 years with her team. And certainly we owe them an immense debt of gratitude for the work of which they've done.
Minister Wilson, you want to touch that? You really have been amazing watching you and listening to you and remaining steady throughout the whole course of it.
Well, thank you, Tina, and thank you, Premier. I actually have to credit the team that I work with. We have a tremendous team, as the Premier indicated, here at the Ministry of Health. And I said to them, Christmas time, and I repeat this, there's no one else I'd rather be in a battle with and be in the bunkers with than this team at the Ministry of Health, because they have supported the efforts of this government. They're committed to to preserving public health, and they have stuck to the wicket for over 2 years. And it's because of them that it makes me, I feel totally blessed and rewarded because of the efforts of the team that stand behind me. Thank you, Premier.
Yeah, thank you for your leadership. Minister Peets, we'll give you little closing remarks and then we'll wrap this up.
Yeah, certainly. I'm certainly glad to lend my voice to explain or answer questions as relates to youth culture and sport. And I'm really glad to share some information tonight to the listening audience. I certainly want to thank my colleagues, particularly the Minister of Health and, of course, the Honorable Premier on the call tonight, as relates to their leadership during COVID. Bermuda, we have done an extremely remarkable job these last 24 to 18 months. And our collective efforts, of course, have allowed us to get to this point. We've learned some things, and as we continue to practice the things that we've learned, we can continue to open up our economy and see a lot of normalcy come back to our daily experience. So I'm really encouraged about where we are, and I'm really, really glad to see that Bermuda has come through this, not unscathed, but certainly a lot better than some other jurisdictions around the world.
Yeah. Premier, we're going to leave it with you. What is it going to be? What's your word? In one word, what's Bermuda's future look like beyond the pandemic and beyond March 31st?
I'm optimistic for the future, Tina, and I'll remain optimistic for the future because you're not able to do this job if you do not have hope and optimism for the future. And I recognize that we've been through a tough time, and I know and recognize and understand and feel very deeply the pain and struggle that is being felt by so many persons. And that is why in this chamber, in this room, in this cabinet chamber, the cabinet meets every week, discusses the matter, and makes sure that we can do our best to advance the policies that will go ahead and assist the people of this country as we move beyond the pandemic. So that's my spirit. And my spirit is reminding of how unified we were at the beginning of this pandemic, recognizing that there will always be issues that will divide us, whether it's, testing and quarantine and masks and vaccinations and all other types of things. But we have to certainly recognize as a country that there is more than unites us than divides us. And though not everyone will agree with every single decision, we must understand and recognize that the government is doing what they believe is in the best interest of the collective country as a whole. So now we're at this particular space. Some people believe we're moving too fast. Some people believe we're moving too slow. We're trying to strike that balance. But as we strike that balance, we're going to need everyone on board to focus on as we move beyond this health crisis, to make sure we tackle the issues of the economy and to get our economy vibrant and running again. So with that, I want to thank all the ministers for their time. I want to thank people who wrote in, and I certainly want to thank the people of Bermuda for their continued work, energy, and support of making sure that they do their part to make sure that we can move beyond the pandemic and be successful. So the word that I have, Tina, is gratitude, certainly to the team, and optimism for the future.
With that, we thank you all, and good night, everyone. Thank you for joining us.
Good night.